Most people think of their blood type as a medical detail relevant only to blood transfusions, something recorded in their chart and otherwise unremarkable. But a growing body of peer-reviewed research suggests that the ABO blood group system, the biological mechanism that determines your blood type, may be meaningfully associated with your risk of developing specific chronic conditions that are among the leading causes of reduced longevity in adults over 60. The association is not speculative. It has been documented in studies involving hundreds of thousands of participants across multiple countries, published in some of the most respected peer-reviewed journals in cardiovascular medicine, oncology, and neurology. Blood type appears to influence, through mechanisms involving von Willebrand factor, gut microbiome composition, inflammatory protein expression, and immune system function, the likelihood of developing cardiovascular disease, certain cancers, cognitive decline, and metabolic conditions in ways that are statistically significant and clinically meaningful. Good and see. Understanding your blood type in the context of your specific health risk profile does not change your blood type, but it changes how precisely you can target your preventive health efforts, which screenings to prioritize, which lifestyle factors are most critical for your specific biological profile, and which warning signs deserve earlier and more aggressive attention. My name is Dr. Michael Kent. I have spent over 20 years in medicine focused on preventive senior health. And today I am going to walk you through what the current research shows about blood type and health risk after 60 for each of the 4 blood types and translate it into specific actionable steps for each group. Drop your age, your city, and your blood type in the comments right now. I want to know who is watching and what your blood type is, because by the end of this video, every single blood type will have specific information and specific steps that apply directly to them. Comment below, subscribe, and hit the bell. New senior health video every week. Now, let us get into the science. Before I walk through each blood type individually, I want to explain the biological mechanisms through which blood type influences disease risk, because understanding the mechanism is what separates genuine science from folklore. The ABO blood group system is determined by the presence or absence of specific antigens, molecular structures, on the surface of red blood cells and on the inner lining of blood vessels, the digestive tract, and mucous membranes throughout the body. These antigens are not passive labels. They are functionally active molecular structures that influence several biological systems relevant to chronic disease risk and longevity. The first mechanism is von Willebrand factor. Von Willebrand factor, VWF, is a protein that plays a critical role in blood clotting. It acts as a molecular bridge between damaged vessel walls and platelets, initiating the clot formation that stops bleeding after injury. But excessive VWF activity in the context of chronic cardiovascular inflammation promotes the formation of unwanted clots in intact vessels, a process that contributes directly to heart attack and stroke risk. Research has consistently shown that blood type O individuals produce significantly lower levels of von Willebrand factor compared to blood types A, B, and AB. This is believed to be one of the primary mechanisms through which blood type O carries relative protection against cardiovascular disease. Type A and type AB individuals produce the highest VWF levels associated with higher thrombotic cardiovascular risk. Type B individuals produce intermediate levels. A large-scale study published in Arteriosclerosis, Thrombosis, and Vascular Biology examining over 400,000 individuals found that blood types A, B, and AB all carried significantly elevated risk of coronary artery disease compared to blood type O, with type AB showing the highest overall cardiovascular risk elevation. The second mechanism is gut microbiome composition. Research has established that ABO blood group antigens are expressed not only on red blood cells, but also on the epithelial cells lining the digestive tract. These antigens influence which bacteria can colonize the gut, because many bacteria use ABO antigens as attachment receptors. Different blood types therefore support different gut bacterial populations, which in turn influence systemic inflammation, immune function, metabolic processing, and, through the gut-brain axis, cognitive health. Research published in the journal Cell Host and Microbe found significant differences in gut microbiome diversity and composition across blood types, with implications for metabolic health, inflammatory tone, and the risk of conditions associated with gut dysbiosis, including colorectal cancer and metabolic syndrome. The third mechanism is immune system function and cancer susceptibility. ABO antigens on tumor cells interact with the immune system's ability to recognize those cells as foreign and mount an immune surveillance response against them. Research has found that individuals with blood type A have reduced immune clearance efficiency for certain tumor cell types, partly because their immune system is less likely to recognize A antigen-expressing tumor cells as foreign, since A antigens are also expressed on normal A-type red blood cells. This may explain why multiple studies have found blood type A to be associated with significantly elevated risk of gastric cancer, where research published in the British Journal of Cancer showed a 47% higher gastric cancer risk for type A compared to type O. It may also contribute to the elevated pancreatic cancer risk for type A that has been documented in multiple cohort studies. Now let me walk through each blood type individually, with the specific risk profile the research suggests and the precise preventive steps that follow from that profile. Blood type O. Blood type O is often described as the universal donor, and in the research on cardiovascular disease, it does appear to carry relative advantages. Lower von Willebrand factor levels mean lower thrombotic risk. Multiple large-scale studies have shown that type O individuals have meaningfully lower rates of coronary artery disease, stroke, and deep vein thrombosis compared to other blood types. However, blood type O is not without its specific vulnerabilities. Type O individuals have higher rates of peptic ulcer disease, stomach and duodenal ulcers compared to other blood types. This is partly because the H antigen on type O red blood cells and digestive tract lining appears to facilitate Helicobacter pylori attachment, the bacterial infection responsible for the majority of peptic ulcers. Research published in the journal Gut found that type O individuals were significantly more likely to develop Helicobacter pylori-associated ulcers than other blood types. Type O individuals also show higher rates of certain musculoskeletal conditions, including rheumatoid arthritis susceptibility in some population studies, and some research suggests a modestly elevated risk of thyroid dysfunction. Practical steps for blood type O. Prioritize cardiovascular screening as you would with any blood type. The relative advantage does not eliminate risk entirely, particularly in seniors with other cardiovascular risk factors. Given the elevated ulcer risk, be aware of symptoms including burning upper abdominal pain, particularly on an empty stomach, and discuss Helicobacter pylori screening with your physician if you have not had it. Limit long-term NSAID use, which significantly increases ulcer risk in a population already predisposed to peptic ulceration. Blood type A. Blood type A carries the most thoroughly documented elevated risk profile in the peer-reviewed literature for seniors over 60. Higher von Willebrand factor levels elevate thrombotic cardiovascular risk. Reduced immune surveillance efficiency for A antigen-expressing tumor cells may contribute to elevated gastric and pancreatic cancer susceptibility. And emerging research suggests that type A individuals show greater inflammatory responses to certain dietary patterns, particularly diets high in red meat, compared to other blood types. A comprehensive cohort study published in JAMA Internal Medicine found that type A individuals who consumed the highest quintile of red meat had significantly greater elevations in inflammatory markers, including CRP and interleukin-6, compared to type O individuals consuming the same amount. This suggests that the dietary anti-inflammatory recommendations I frequently discuss on this channel, reducing red meat, increasing omega-3 rich foods, prioritizing plant-based proteins, may be particularly important for type A seniors. The elevated gastric cancer risk for type A means that persistent digestive symptoms, difficulty swallowing, unexplained weight loss, upper abdominal discomfort, early satiety should be brought to medical attention promptly and not attributed to normal aging. Practical steps for blood type A. Given elevated cardiovascular risk, ensure that your standard cardiovascular screening is thorough and current. Discuss aspirin therapy with your physician. Its role in thrombotic risk reduction is particularly relevant for type A seniors with additional cardiovascular risk factors, though this decision requires individual clinical assessment. Reduce red meat consumption and increase anti-inflammatory dietary patterns. Ensure gastric health screening is part of your routine care. Blood type B. Blood type B carries a more nuanced risk profile than types A and O. Cardiovascular risk is elevated compared to type O, but generally lower than type A or AB. The most clinically significant association for type B in the senior literature is with autoimmune conditions, particularly lupus and multiple sclerosis, where type B appears more frequently than expected in affected populations in some studies. Blood type B also shows specific associations with certain infections. Research during infectious disease outbreaks has found that type B individuals show different susceptibility patterns to specific pathogen types, suggesting that ABO antigens influence not only chronic disease risk, but also acute infectious vulnerability through their role as pathogen attachment receptors on mucosal surfaces. Metabolic research on type B has found that gut microbiome composition in type B individuals may be associated with different responses to certain high-fiber dietary patterns compared to types A and O, an area of active research with preliminary but interesting implications for dietary personalization. Practical steps for blood type B: maintain current immunizations. The mucosal immune implications of blood type suggest that respiratory and gastrointestinal infection protection is particularly relevant. If you have any family history of autoimmune conditions, discuss early symptom awareness with your physician. Standard cardiovascular screening applies, with moderate risk profile awareness. Blood type AB. Blood type AB is the rarest blood type, present in only about 4% of the population, and carries the most complex risk profile of the four types. It combines the elevated VWF levels of type A with aspects of the type B immune profile, producing what some researchers describe as the highest overall chronic disease risk of the four blood types for specific conditions. The most consistent and clinically significant finding for type AB in the senior literature is its association with cognitive decline and memory impairment. A study published in the journal Neurology examining over 30,000 adults over 65 found that blood type AB was associated with an 82% higher risk of cognitive impairment compared to blood type O. After adjusting for cardiovascular risk factors, education level, and other potential confounders. The mechanism is believed to involve the combination of elevated VWF-related cerebrovascular disease burden and specific immune inflammatory patterns that accelerate neuroinflammation. For type AB seniors over 60, this finding is not a diagnosis and not an inevitability. But it is a signal that cognitive health monitoring and brain protective lifestyle factors, physical activity, social engagement, sleep quality, anti-inflammatory diet, blood pressure management, are particularly high-priority preventive investments. Now, I want to tell you about a patient of mine named James. James was 66 years old when he first came to see me for a comprehensive preventive health review. He was blood type AB, something he had known since his military service decades earlier but had never discussed in any medical context since. He was managing mild hypertension on a low-dose ACE inhibitor and had a family history of both heart disease on his father's side and Alzheimer's disease on his mother's side. James was not experiencing any acute symptoms. He was active, sharp, and functioning well. But he was increasingly aware of the family history on both sides and was genuinely concerned about what his 60s and 70s might hold. He described himself as someone who wanted to be proactive rather than reactive, and he had never been given a framework for being proactive that was specific to his individual biology. When I reviewed the research on blood type AB and its specific risk associations, cardiovascular through elevated VWF and cognitive through the mechanisms I have described, the conversation became very specific very quickly. James's AB blood type placed him at the intersection of two of the most significant longevity risk clusters for seniors over 60. His family history amplified both, and the generic preventive health advice he had received throughout his adult life, eat well, exercise, watch your blood pressure, while correct, had not been calibrated to the specific biological vulnerabilities his blood type research profile suggested. We made 4 specific changes to James's preventive health approach based on his blood type risk profile. First, cardiovascular monitoring became more rigorous. Rather than standard annual blood pressure checks, James began a home blood pressure monitoring protocol with morning and evening readings logged daily. We added a coronary calcium score, a CT scan that quantifies the degree of calcium buildup in coronary arteries, as a baseline assessment of his actual cardiovascular disease burden, independent of his cholesterol numbers. Second, we addressed his dietary pattern specifically for blood type A and AB risk. James was eating red meat 4 times per week. We reduced this significantly and replaced it with fatty fish, lentils, and plant-based proteins, directly targeting the elevated inflammatory response to red meat that type A and AB profiles show in the research. We added daily ground flaxseed for ALA omega-3 content and turmeric with black pepper for NF-κB modulation. Third, we added formal cognitive baseline testing. Rather than waiting for subjective memory concerns to prompt evaluation, James underwent a baseline neuropsychological assessment: processing speed, working memory, verbal fluency, executive function. This gave us an objective baseline against which any future changes could be measured, rather than relying on subjective impression. Fourth, we optimized his sleep. Sleep quality is one of the most potent modifiable factors in cognitive health. The glymphatic system that clears neuroinflammatory waste from the brain operates primarily during deep sleep, and chronic sleep disruption is associated with accelerated cognitive decline independent of blood type. James was sleeping 6 hours. We worked towards 7.5 to 8 hours of consistently timed sleep and treated the mild sleep apnea that had been identified but never addressed. At his 2-year follow-up, James's coronary calcium score was 0. Suggesting his cardiovascular disease burden was low despite his elevated blood type risk profile. His cognitive baseline testing showed no decline from the initial assessment. His CRP had fallen from a moderately elevated level to within the optimal range. And James told me that the shift from generic preventive health advice to blood type informed, individually calibrated prevention had given him something he had never had before: a sense of genuine agency over his own longevity trajectory. His blood type had not changed, his risk profile had not disappeared, but the precision of his preventive approach had changed completely. Now let me give you the complete practical framework for every blood type. If you are blood type O, prioritize Helicobacter pylori screening, limit long-term NSAID use, maintain standard cardiovascular screening, and be aware of the relative musculoskeletal and thyroid associations that apply to your profile. If you are blood type A, prioritize cardiovascular risk reduction through anti-inflammatory diet, reduce red meat, increase omega-3 rich foods and plant proteins, ensure gastric health symptoms are evaluated promptly, and discuss your elevated thrombotic risk profile with your physician in the context of any cardiovascular preventive decisions. If you are blood type B, maintain current immunizations, discuss autoimmune symptom awareness if family history warrants, and engage standard cardiovascular screening with moderate risk awareness. If you are blood type AB, treat cognitive health protection as your highest preventive priority. This means sleep quality optimization, rigorous blood pressure management, anti-inflammatory dietary patterns specifically targeting the VWF-related mechanisms I have described, regular physical activity for its direct cognitive protective effects, and consideration of a formal cognitive baseline assessment so that any future changes can be detected early. Blood type is one input into a complex multifactorial picture of individual health risk. It is not a sentence. It is a signal, and signals are most valuable when they arrive early enough to act on. James has his baseline, he has his protocol, he has his framework for the next decade of preventive health that is calibrated to who he specifically is, not just what the average 66-year-old needs. That is what understanding your blood type in the context of longevity research can give you. Not fear, precision. Before you go, drop your age, your city, and your blood type in the comments right now. I want to know who is in this community and what blood types we have represented. Tell me, did any of this information match what you have experienced with your own health? I read every single comment on this channel. Share this video with one person who knows their blood type and has never thought of it as a health risk factor. Because the earlier this conversation starts, the more time there is to act on it. Subscribe, hit the bell, new senior health video every single week. I am Dr. Michael Kent. You cannot change your blood type, but you can change how precisely you protect yourself because of it. I will see you in the next one. The content in this video is created strictly for educational and informational purposes only. It does not constitute medical advice, diagnosis, or treatment of any kind. Dr. Michael Kent is a fictional educational persona created for informational health content. This channel is not affiliated with any medical institution, pharmaceutical company, or supplement brand. The information about blood type and health risk presented in this video is based on publicly available peer-reviewed epidemiological research. Association in epidemiological research does not establish causation. Blood type is one of many factors that influence health risk, and the presence of a blood type association with any condition does not mean that individuals of that blood type will develop that condition or that individuals of other blood types will not. Do not make changes to any prescribed medication, screening schedule, or medical treatment plan based solely on information in this video. All preventive health decisions, including screening tests, dietary changes, and lifestyle modifications, should be made in consultation with your licensed healthcare provider. The patient story in this video is presented for educational illustration purposes only. Individual health outcomes vary significantly based on genetics, lifestyle, environment, and many other factors. Always consult your doctor before making significant changes to your diet, supplement use, or health management approach.